Welcome to Chai Chat. Hello, salam, namaste. Welcome to Chai Chat and Community, our rapidly growing community. I'm Dr. Veena Barsiwal. I would like to start by acknowledging the traditional custodians of the country and pay my respects to elders past, present, and emerging. Friends, this is the World Wellbeing Week, a global initiative to promote awareness of the importance of well being. And tonight, we will be addressing the physical, mental, and emotional aspect of well being in our chat on breast cancer and breast screening with our very able guest, Dr. Farwa Rizvi, who is a research fellow, Department of Medicine at the University of Melbourne. The mantra for today is keep things simple for your well being. Easier said than done. Yes, I agree. But we don't need to be sick to appreciate health, do we? More about that later. For now, I'll invite Dr. Farwa to tell a bit about herself and the work that Dr. Fava you do within oncology research.
Thank you, Veena. It's really nice to meet you tonight, and thank you for the opportunity to talk about such an important topic in a very nice, informal way. Really appreciate that. So, as you know, I'm Dr. Fava, and I'm a GP by background, and I did my PhD in public health. And I'm working currently as a postdoc research fellow at the Department of Medicine at the University of Melbourne and the St. Vincent's Hospital. And I also have a dual role across Monash Health.
Mhm.
So my work, Veena, especially after my PhD, has always revolved around women's health, women's reproductive health, breast cancer prevention and screening, clinical trials around that, and mostly oncology. I just wrapped up a clinical project with my team. We were working on the Australian National Pathway for Cancer Pain Management, which included all the guideline updates for opioid management and surgical interventions and all the
Mhm.
other therapeutic management for the Australian cancer patients. So it has always been around that sort of arena in oncology and prevention.
That is very impressive and very important work that you are doing. So, thank you so much for your time tonight, and it's really nice to be talking to you. Breast cancer, such a scary word, isn't it? Like, everybody's like, we don't want to talk about it, we don't want to hear the word. So, what is breast cancer? And what should a woman be looking for, wishing not to find it, of course?
That's actually very nicely put. I would say that so breast cancer is basically any aggregation or development of abnormal cells,
Mm,
and in such a way that the patient can sometimes have symptoms, but most often they don't show any symptoms. So when you ask, okay, in a patient, in a woman, let's say, because as you know, the gender itself, the sex, the female sex, XX, is the main risk factor for having breast cancer. And statistically speaking, 99% women may breast cancer hota hai, and only 1% of men can get breast
mm,
cancer. So it's like
mm,
very clear to us this is a female disease for that.
mm,
Age ke factors bhi hain. I'll talk a little bit more about it, but the presenting sign symptoms in women can be, sometimes no symptoms at all, and the
mm,
tumor or the cells जो हैं वो malignant cells, so breast tissue के अंदर develop हो रहे हैं. So breast
mm,
tissue has that, connective tissue, and then ducts उसके अंदर होती हैं, mammary gland जिसको आप बोलते हैं, milk ducts होती हैं. So the breast cancer cells can develop in that breast tissue. It can happen in situ, or it can have a primary and then spread, जो जिसको आप metastasis बोलते हैं, चाहे वो करीब की lymph nodes में चला जाए or other organs में चल जाए. It all depends कि किस stage पे patient का diagnosis हुआ है, like the stage 1, stage 2
mm.
and 3 जो lymph nodes involved होते हैं, and stage 4 is the metastatic stage जहाँ पे lungs or brain or liver सब involved हो जाते हैं. So breast cancer
तो और
itself,
जगह भी बॉडी में फैल सकता है कि भी सिर्फ ब्रेस्ट
exactly,
में नहीं
exactly.
रहेगा.
Yeah, yeah.
It can reach the other places.
So the primary, the first stage would be when it's just localized to the breast tissue.
Mm,
Stage 2
mm,
and 3 when it's going around the adjacent lymph nodes, and then the stage 4
mm.
obviously when it's really spread to the other body organs. So that is
Right.
breast cancer in itself, and it does have many different types. Some of them are not very aggressive. Some of them are very aggressive. Some of them
Mm,
have those. So because you were asking what's breast cancer, so just यहाँ पे quickly मैं आपको बता देती हूँ in a summary that sometimes it can be an estrogen receptor positive, progesterone receptor positive, and HER2 receptor positive, triple positive breast
So
cancer.
these are, from the sound of it, these are hormones
Yeah, these
different.
are, yeah, and basically, so these receptors, when we talk about it, the ERPR or the estrogen and progesterone receptor positive breast cancer tissue में ये pathologically, on a pathological basis ये find किया जाता है tissue biopsy के ऊपर. And the types depend के treatment modality पे क्या होगी. So it
Hmm.
really matters कि breast cancer का diagnosis तो हुआ है, but what type of breast cancer it is and what
Hmm.
stage of breast cancer it is. Just like triple
Hmm.
negative breast cancer जो है वो थोड़ा ज़्यादा aggressive होता है, and
Hmm.
estrogen progesterone positive receptor वाला पे tends to respond to the hormone therapy. So it really depends के what was the woman's age when she was diagnosed with breast cancer, what was the type of the breast cancer, what was the presenting modality, what was the stage at the time of surgery.
Hmm. So, okay, thank you for that. Um, Now we keep hearing the words mammogram, breast screening, go for regular checks, go for routine checks. So I want you to tell us, why should women go for routine breast screening regularly, and what age group should get tested, and why, like, how does the Breast Screen Victoria program work with
Okay,
regards to
that's
this?
really good question. So, Veena, I'll divide it into two portions. First, what's breast screening and how does that work?
Hmm.
And then the federal program here in Australia, how does that work? So, first of all, when I was talking about breast cancer, I just want to mention that it is the most common cancer disease occurring in women globally. And every year, there are millions of women who are diagnosed with that. And if you're talking in terms of mortality deaths, so there are like 640,000 approximate deaths annually, which is like a massive number. And even
Hmm.
within Australia, there are thousands of women diagnosed with breast cancer every year. And I think the last statistics, जो है, I think they were like almost, I think it was, to the best of my knowledge, I think it's 3,700 something women जिनकी deaths हुई थी. So clearly we know that this is one of the most common presenting cancers and most common present cancers in women. The other thing is कि जब हम बात करते हैं कि breast cancer जो है, and if you remember I said sometimes there are no symptoms. So it is
Hmm.
developing, but people wouldn't know it's
Which
happening.
is scary, yeah.
Exactly, which is also
Which
scary
makes
because
screening all the more important, doesn't it?
yeah.
Because you are
So
saying
also,
thousands. Sorry, go
yeah.
ahead.
No, that's fine. And I was just going to say that even when the women do have any lump as a presentation, it might not be painful. And that's what
Hmm.
makes it scary because a lot of the women, and I'm now kind of talking more about the social demographic sort of presentation in women and unki jo psychology hai कि because it's not a painful lump, they wouldn't be contacting their GP or their doctor or any
Hmm.
healthcare provider because
Hmm.
if it's not painful, that's fine. Which is the other way around. मैं आपको दोबारा से मैं emphasize कर रही हूँ. I want to reiterate कि अगर painless lump है breast में किसी को भी feel होता है जरा सा भी थोड़ा सा raised area है breast पे कोई tissue पे या कोई lymph node axillary region में feel होती है or any discharge nipple से और breast के ऊपर discoloration है कुछ भी है, any woman who's in the 30s or 40s or 50s and beyond, you have to contact your GP or your healthcare provider immediately. Please do not sit. Usko chhode nahi. So, having said that, that question is sort of like a nice segue. Sorry, that statement is a nice segue into my next explanation. Ke when there are women who do not have any presenting signs and symptoms, and they might have a breast cancer developing, how do you catch it in the early stage? Because the whole concept of breast screening is based on the fact that आप जल्दी screening करें so that you can have an early treatment and early diagnosis and early treatment. So you can save more lives, right? At the end of the day, it is literally about a quick diagnosis, good treatment plan, and saving lives at an early stage. Having
Hmm.
said that, जो mammogram पर बात करी थी, it is a procedure which involves very low dose X-rays which pass through the breast tissue. Or it's a procedure. I've shared some links that hopefully you can share it with the video. This
Yes.
breast tissue को थोड़ा सा press करके, and it's not supposed to be a very painful procedure. There's just a little bit of discomfort. It is
Hmm.
still worth it. और उसमें खवातीन जो हैं, anyone who's between 50 to 74 years of age, they can actually go for the mammogram and they can get themselves tested. So this procedure itself involves only x-rays, or they're not dangerous because यूजुअली जो एक्सरेज आपको चेस्ट एक्सरे जो है करवाते हैं या कोई और एक्सरे करवाते हैं, उसमें भी इतनी बहुत लो डोज होती है, so it really doesn't matter. So basically a lot of the patients sometimes say, oh, अगर एक्सरे मैमोग्राम करवा लिया तो that might in itself be a dangerous thing. लोग बहुत घबराते हैं इस बात से. So I want to clarify कि आप हमारे जो एवरीडे लाइफ में फ्रॉम द अर्थ, फ्रॉम द ग्राउंड, फ्रॉम द डिफरेंट थिंग्स, लो डोज रेडिएशन को हम हर वक्त फेस कर रहे होते हैं, विच इज नॉट रियली डेंजरस. और मैमोग्राम जो है, अगर आप समझ लीजिए कि एक साल में 1.5 माइक्रोसीबेट इसकी यूनिट है जो लोग फेस करते हैं, तो इसकी 0.7 है और आप 2 साल के बाद करवा रहे हैं. सो वट एवर नेचुरल फॉर्म में लोगों को बहुत माइनर लेवल पे रेडिएशन मिल रही है इन लेट्स से 4 months, वो उसके इक्विवेलेंट है. तो पहली बात तो मैं क्लैरिफाई करना चाहती हूँ, क्योंकि आई टॉक अ लिटिल बिट अबाउट माय स्टडी कि पीपल हैव दीज मिसकंसेप्शंस कि ओ मैमोग्राम से कैंसर हो जाएगा. ऐसी बिल्कुल बात नहीं है. इट्स एक्चुअली गोइंग टू सेव द लाइफ.
रादर जहां आप कह रहे हैं कि भी मैमोग्राम जो मतलब इट कैन बी पेनलेस, रादर देयर इज अ lump which is painless, it is all the more reason to go quickly to your doctor. तो उस केस में आप मैमोग्राम जो कि एक छोटा सा एक्सपोजर हो रहा है रेडिएशन का, बट यू आर गेटिंग अ डायग्नोसिस much earlier than कि भी जब तक ये और बढ़ेगा, and you by the time you diagnose it, it has maybe traveled to other parts of the body. तो उसकी बदले में तो ये कुछ भी नहीं है, वो छोटी सी रेडिएशन जो हो जा रही है.
Because you've summed it up in a nutshell. And the thing is, the mammogram has the ability to pick up any cancerous cell in the breast tissue, even when the woman wouldn't feel it for the next few years. So imagine कि कितना जल्दी इसको early diagnosis हो सकता है. एक तो ये बात हो गई. The other thing you said, you wanted to know a little bit about the breast screen Victoria and breast screen Australia के जो program है. So this is a federally funded program जो कि ऑस्ट्रेलिया में in all the states ये free of cost है. और after every 2 years, any woman over 40 is eligible to have a free mammogram. And यहाँ पे मैं I would like to reiterate कि जितने भी technicians हैं, counselors हैं और breast screening nurses हैं और staff हैं, they're all females. कोई males वहाँ पे involved नहीं है, क्योंकि a lot of the women from South Asia, obviously for many reasons, religious or cultural reasons, they don't want to go be seen by a male healthcare provider. तो वो सारी उन्होंने females रखे हैं staff. दूसरी बात ये है कि जो women हैं, breast screen Victoria and breast screen Australia, हर state के अपने programs हैं, तो वो women को letters भेजते हैं बाकायदा, जो भी resident women हैं और citizens हैं ऑस्ट्रेलिया में, from 50 to 74 years of age, every 2 years, requesting them to come over, have an appointment, like a regular screening test done. जो खवातीन यहाँ पे I would like to say, and this is applicable to all the women living within Australia और जो overseas में हैं, and we're focusing on South Asian women. By extension, we can focus on other ethnic groups as well. And the thing is that any woman who feels that they have any symptoms like an abnormal discoloration of the breast skin, or any lump that they feel in the axilla or in the breast itself, or any discharge, colorless or colorful or blood wala or whatever from the nipple, whatever symptoms there are, they need to talk to their GP ताकि उनकी वो mammogram करवा सकें. अच्छा, तीसरी बात जो है mammogram में I'd like to mention is that there is a lot of debate going on recently about the breast density और patients को बताना चाहिए कि नहीं. So US में अब ये करते हैं कि when the mammogram is done, the women are informed how dense their breasts are, because breast density itself has now been recognized as an independent risk factor for later on having breast cancer. So all the more reason for women to have regular mammograms. Breast density कई दफा ज़्यादा भी होती है in 30s and 40s because of many reasons. A, because the reproductive age group and all of those factors matter. However, breast screening में mammogram भी आ जाता है, इसमें ultrasound भी आता है, और इसमें CT scan भी आता है और MRI भी आता है. So वो सारी बात I'll talk later about the low risk and the regular high risk screening. But when we say breast screening, the mammogram is the first line defense, but then it's sometimes coupled with ultrasound and MRI अगर जरूरत पड़े.
तो just to clarify, when you say axilla, आपका मतलब है armpit में जैसे जो
the armpit, sorry, I should have used that word. Yes, the armpit can be sometimes थोड़ा सा लंप सा फील अगर होता है, दैट्स probably the lymph node जहां तक वो ब्रेस्ट कैंसर का आया है. तो
तो कुछ अगर
anything
फील
that
होता है
women,
वहाँ पे तो देन हाँ जी,
yeah, yeah.
एज हमने आई भी डिड वी टच अपॉन द एज नहीं कि भी
Yes, yes, yes. So the population-based screening programs जो हैं, yes. Thank you, Chris. I'm just going to come to that question. So the age groups are who are actually actively pursued for having mammograms are from 50 to 74 years of age. However, any woman who's above 40 years of age is eligible to have a free screening in the countries, in the high-income countries where the mammogram is freely available, versus the other countries, even in South Asia or in Asia, जहाँ पे maybe आपको out of pocket देना पड़ेगा. But if there are any suspected symptoms, please go for a mammogram through your healthcare provider. Second thing, breast cancer की mortality जो I'm going to quickly touch about it because a few people asked about the age group. It can present in the 30s age group, women in the 30s and women in the 40s. जितना जल्दी एज में ब्रेस्ट कैंसर के डायग्नोसिस होगा या प्रेजेंटेशन होगी, it can be a bit more aggressive. So all the more reason that I know that we always focus on women who are perimenopausal or postmenopausal or 50s above, say. But women in the 30s and 40s, अगर कोई family का history है positive, या अगर कोई भी genetic predisposition है या familial है, या कोई other risk factors हैं, obesity or extreme overweight, dense breast tissue, so whatever it is, it's good to be evaluated ताकि उनका high risk जो है पता चल जाए कि है कि नहीं है. And there are ways to do that high risk. So quickly, age groups 30s, 40s, they are eligible for breast screening अगर कोई symptoms है. Otherwise, regular screenings from 50 onwards every 2 years.
तो लाइक टू सम इट अप, अगर आपकी फैमिली में अगर हिस्ट्री है तो मे बी
Yes.
द चांसेस आर इंक्रीज, लेकिन अगर हिस्ट्री नहीं है इसका मतलब ये नहीं है कि यू आर इम्यून फ्रॉम द प्रॉब्लम और हो ही नहीं सकता है,
You
तभी भी
actually just
आपको
said the
जानना
right
है.
thing. Bilkul. So,
और
okay, this is interesting. Sometimes family की history होती है, but there are some genetic testing. Like for example, I'll say BRCA1 gene and BRCA2 gene का test होता है, जो कि family history जिसमें high risk हो, maternal side से grandmother or mother or sister. So they do those testing. वो है available हर country में, Asia में भी, South Asia में भी, और बाकी European countries में, US में भी. The thing is कि just because someone has a positive family history does not make it कंफर्म केस के उन खातून को भी ब्रेस्ट कैंसर
होगा
हो
ही
जाएगा.
जरूर, हाँ, ऐसा भी नहीं है कि डर जाओ कि नहीं नहीं बस होना ही है.
The risk is still the same till they are evaluated. Genetic testing होगी, gene testing होगी, और there are some basic validated tools जो कि risk tools आप बोलते हैं, जो कि specialist doctors हैं, radiologist हैं या oncologist, breast oncologist की team होगी. They will do that और फिर पता चल जाएगा कि okay, that particular woman is a high risk case or not. She'll be followed up every year. A thing.
राइट,
The
हाँ.
other thing जो आपने बात की है जी कि जिन खवातीन में कोई हिस्ट्री नहीं है, it doesn't mean that they shouldn't be going for testing because they have the same level of risk for developing breast cancer as any other woman with a positive family history. So that's why it makes it a very complicated case. And we want to emphasize that please, all the women, please go for regular mammograms if they're 50 plus. And if there are any high risk women, and if the women feel that कोई sign symptoms है, then definitely go for a mammogram through a healthcare provider.
तो ये you just mentioned low risk screening versus high risk case, so please tell us a little bit about that.
Sure. So low risk screenings are basically a part of the regular population based public health screenings in countries जहाँ पे, for example, Australia का मैं आपको example दे सकती हूँ, and I just talked about it कि breast screen Australia या breast screen Victoria ने federally funded है, और हर state में free every 2 years checkup mammogram अगर required है तो women का होगा. तो वो उनकी age group है 50 to 74 years of age. Now this brings us to the other one, the other side of the spectrum, which is the high risk screening. That means again the women in their very rarely 20s as well, but especially 30s and 40s, जो अभी उस गवर्नमेंट प्रोग्राम में नहीं आई हैं, 50 से तो रेगुलर स्क्रीनिंग शुरू हो जाएगी, राइट? तो अगर उनको लगता है कि उनकी फैमिली की पॉजिटिव हिस्ट्री है और अगर और अदर रिस्क फैक्टर्स हैं, और दे हैव faced any minor signs or symptoms breast के जो मैंने अभी पहले बताए थे, then immediately they are eligible for the mammograms, but they will have to go through the healthcare provider system. तो वो पहले जीपी से बात करेंगी, वो उनको फिर रेफर कर देंगे, एंड डिपेंड करता है. They might end up having a mammogram or most probably having a mammogram and an ultrasound, or they might even go for an MRI. जिस तरह से भी उनको specialist doctors जो हैं advise करेंगे.
Hmm. So once your job is to get there, and once you get there, then you'll be taken care of कि भी हाँ क्या
Exactly.
जरूरत है, कितने
Exactly.
gap पे जरूरत है,
बिल्कुल
and
बिल्कुल.
yeah, and how
आपको
much risk
अगर
is
Exactly. I mean, I'll give you a quick example. So,
it?
Australia, even in Victoria, private sector में, so a few colleagues of mine, they do work as radiologists, and they are part of the multidisciplinary team. That means कि अगर एक खातून आती हैं high risk के साथ, कोई family
Hmm.
history है, और उनकी testing हुई है, and उनका mammogram भी हो गया है, and if there's something suspicious, her case would immediately be taken to the breast oncologist and a breast surgeon and a radiologist, and the GP would be a part of that. So that is what we call an MDM, or multidisciplinary committee, sorry, MBC or MDM meeting. That
Hmm.
means that her case would be discussed with all those specialist consultants, and then
Hmm.
the forward way, जो भी करनी है, surgery करनी है, नहीं करनी है, उनको observation में रखना है कि नहीं, सारा कुछ किया जाएगा. So when you were saying high risk, that is all a part of the high risk training procedure.
Hmm. So next, tell us about the BeamVic project, because you have
So
been doing some research, and what are your current your findings from your current research?
thank you, Veena. I'm glad you brought it up. I'm very excited about this Being Big study. So first of all, Being Big study stands for Breast Cancer Education and Awareness for Mammography in Victoria. And we
Mm-hmm.
had to have an acronym, and my team and I, we thought, oh, Being Big actually is a really good name. You don't have to say the full name, but
Mm.
essentially it's my study, and I'm working as a chief investigator for this. I started the work last year. So I'm working at the Department of Medicine at St. Vincent's Hospital and the University of Melbourne for this particular project. We were very lucky. We had a research funding approval for this. And in a nutshell, I'm looking for Victoria-based Indian and Pakistani women जो कि CAL group में आती हैं, the culturally and linguistically diverse population groups. And I
Mm-hmm.
wanted to focus on the Indian and Pakistani women, especially in the mid 30s and mid 40s onwards, women from the
Mm-hmm.
30s, 40s, 50s, 60s up till their 70s within Victoria.
Mm-hmm.
Um, and I wanted to have a look at, and I wanted to explore their perceptions and their attitudes towards breast cancer screening and any gaps which were there. Because there are a few sporadic work which has been done in Victoria, Chinese population पे भी हुआ है, but to my surprise, Veena, Indian and Pakistani खवातीन पे अभी तक कोई काम नहीं हुआ था. Or
Mm.
awareness, like it's sort of like a baseline level in which what are the facilitators or barriers, what are the factors which affect their information level or their accessibility to breast cancer screening. So, what are those factors? And then I wanted to see, okay, I didn't just want to talk to the women in Victoria, I wanted to talk to the healthcare providers practicing within Victoria as well. And to date, I've actually completed 48 interviews now. So we have
Mm.
interviews from 24 women within Victoria who are anywhere from the 35 age group
Mm.
onwards, from
Mm.
Pakistan and India, and from all across Victoria, from all walks of life, from all levels of education. And I also completed about 15 interviews in which there were 9, I believe, with the general practitioners who were practicing here in Victoria. And then the others were done with the breast oncologists, breast surgeons, radiologists, and radiographers who were associated with the breast screen program within Victoria. So at the moment, we're just wrapping up the project.
Mhm.
The findings are there now, and they're quite interesting findings. If you wanted to go on about that, I would love to, but if you have time for that.
Yeah, you can just share a little bit with us. Yes, we have to be mindful about the time, definitely.
I'm going to quickly tell you about the 4 major findings
Mm-hmm.
from the project, because at the moment we're just in the process of the research publication work and everything.
Mm.
Hopefully will be published soon for that. But the most interesting finding that came out of it was women's uh, preference for a culturally and linguistically targeted information for breast screening. And
Mm-hmm.
I realized that despite the high levels of education, बहुत खवातीन जो हैं उनको नहीं पता था कि ब्रेस्ट स्क्रीनिंग क्या है या क्यों
Mm.
करानी चाहिए. a
Hmm.
lot of the women were hesitant कि इनको ये भी नहीं पता था कि female technicians होंगे कि नहीं करने के लिए.
Hmm.
A lot of the cultural sort of nuanced factors which can only be captured in an interview. You can't really get that information in a cross-section survey. And that was the
Hmm.
reason basically that I wanted to have a qualitative surgery कि मैं थोड़ा सा explore करके पूछा अच्छा, okay, what are the factors? So clearly, education level is not the problem, or even the communication is not the problem, which is very
Hmm.
interesting for me because I was offering कि मैं उनसे बात कर लूँ उर्दू में या हिंदी में या इंग्लिश में. Everybody chose to talk in English because people are from India and Pakistan. They're all multilingual, right?
Yeah.
However, the thing that really was of interest was कि उनको basic information नहीं पता थी. स्क्रीनिंग
Hmm.
कब करानी चाहिए है, कौन सा एज ग्रुप है, क्यों करानी चाहिए, खतरनाक तो नहीं है, और किस वक्त कांटेक्ट करना चाहिए हेल्थ केयर प्रोवाइडर से या जीपी से. सो वी हैव टच्ड ऑन ऑल ऑफ दोस टॉपिक्स इन द
Those
इंटरव्यू
points.
राइट
Yeah.
नाउ.
Hmm.
The other finding that came, that was actually quite important was that fear of pain. So I'm just going to say to all the prospective women जब भी कराने जाएंगे mammogram, it's not supposed to be a painful process. Yes, it can have a little bit of discomfort, obviously, but it's not an insanely painful process. लोगों ने बहुत ज़्यादा बात करके वो एक दूसरे को डरा देते हैं, ऐसी बिल्कुल बात नहीं है.
हाँ, मेरे
I
ख्याल
would
से
find
पेन तो बिल्कुल मतलब जब वी कैन कीप इट आउट. हाँ, डिस्कम्फर्ट जो कह रहे हो हल्का सा वो भी हो
exactly
सकता है.
discomfort मतलब बिल्कुल बिल्कुल. और
Hmm.
the thing is कि जो थोड़ा सा I want to bust the myth, the misconceptions कि लोग बात करते हैं ओ अगर मैमोग्राम करवा ली तो उससे ना ब्रेस्ट कैंसर हो जाए.
Hmm.
उससे कैसे हो जाएगा ब्रेस्ट कैंसर जब आपको पता ही नहीं है, आपके सिम्टम्स नहीं आ रहे. सो इट इज बेटर दैट यू गेट योरसेल्फ स्क्रीन राइट. और उसकी डोज लाइक आई सेड बहुत कम होती है. एक तो ये बात. द अदर थिंग इज के I would like to have the mammography normalized. जिस तरह से I've been अब मैं एज ए मेडिकल प्रोवाइडर आपको मैं बात करती हूँ कि अच्छा आप अपने आयरन लेवल्स चेक करवा लें और अपना विटामिन D3 लेवल चेक करवा लें बिकॉज आई एम ट्राइंग टू स्क्रीन यू कि आप
Hmm.
में कोई विटामिन डेफिशिएंसी तो नहीं है. अगर है तो हम आपको सप्लीमेंट्स दे देंगे और
Hmm.
आपका ठीक हो जाएगा, विटामिन D3 लेवल भी ठीक हो जाएगा और आपके आयरन लेवल्स भी ठीक हो जाएंगे. करेक्ट.
Hmm.
देन खवातीन जो है सर्वाइकल स्क्रीनिंग भी करवाती हैं हर 5 साल के बाद, राइट.
Hmm.
पैप जिसको पहले बोलते थे वो 5 ईयरली सर्वाइकल स्क्रीनिंग है. So my point is कि breast cancer screening is just like that. It is literally a scan of the breast tissue just to ensure that everything is fine and you can rest easy. और आप 50 के बाद रेगुलर करा सकते हैं. और जिनको ज़्यादा डर लगता है या उनको लगता है कि उनकी कोई सस्पिशियस टाइप की हिस्ट्री है या सिम्टम्स हैं, दे कैन ऑलवेज हैव इट डन अर्लियर. तो इतनी कोई खराब और मुश्किल बात नहीं है. बट आई रियली होप कि द वुमेन आर more convinced after this.
हाँ,
Okay,
नहीं
it's a
डेफिनेटली.
normal thing.
एंड जैसे आप कह रहे हैं कि कई रेस से ही उसे एक्सरे से ही डरते हैं, बट इफ इट वर डेंजरस तो वो ऐसा टेस्ट बनता ही क्यों, या ऐसा टेस्ट पास ही कैसे
बिल्कुल,
होता कि
बिल्कुल,
उससे अगर
बिल्कुल.
ब्रेस्ट कैंसर होगा तो देन इट डजंट मेक सेंस टू हैव सच अ
Absolutely.
टेस्ट.
It is done around the world. It is one of the most common screening tests. Literally, हर country में होता है. मतलब चाहे वो high income है, low income है. I remember someone asked the question कि ethnicity matters or not, but yes, ethnicity का बहुत बड़ा role है. Breast cancer ज़्यादा common South Asian women में है, Southeast Asian women में भी है. Breast density is a bit more common in the Southeast Asian and East Asian women. But in terms of अब इस पर मैं आपको एग्जैक्ट स्टेटिस्टिक्स तो नहीं बता सकती, बट इतना है कि जो ब्रेस्ट कैंसर के डायग्नोसिस हैं वो एशिया में ज़्यादा मिल रहे हैं. Or the other thing is that breast density itself, because it has been only recent in the recent years that it has been recognized as the independent risk factor, and unfortunately, वो Southeast Asian women में ज़्यादा पाई जाती है breast density. Other than that, so I would say yes, ethnicity does matter. In not the only thing, but in as you know,
वन
it's
ऑफ द
sort of like a
फैक्टर्स.
web of yeah, it's sort of like a web of causation, and there are multiple factors which can lead to breast cancer. And family history is not the most important thing only. There are so many other lifestyle factors as well.
Yes. And
Yeah,
also then it makes it even more important for South Asian women to go for the testing, जो कि
absolutely, absolutely. Yeah.
okay, no, that's the
Someone asked what age group is the most susceptible. I think I've
most.
already answered that. Yeah, yeah.
So is there anything else that you would like to add to what we have talked about tonight? कुछ और जो
Uh,
आपके mind में हो कि भी
so
okay, I wanted to
I
say this.
Yeah, yeah. I think I'm just going to quickly summarize it that because today's focus, I understand, was around breast cancer screening and prevention, which is at the level of primordial prevention and primary
Mm,
prevention. ठीक है, लेकिन
हम्म,
अगर ब्रेस्ट कैंसर डायग्नोज हो जाता है तो उसमें भी, लाइक आई सेड अर्लियर, देयर आर डिफरेंट टाइप्स ऑफ ब्रेस्ट कैंसर, डिपेंड करता है कि उसकी कौन सी टाइप है। सर्जिकल इंटरवेंशन हो सकती है, कीमोथेरेपी की मोडालिटीज अवेलेबल हैं, रेडियोथेरेपी अवेलेबल है। तो वो तो बात की बात है कि फिर ऑब्वियसली आपके स्पेशलिस्ट डॉक्टर्स की टीम जो है, दे विल टेक ओवर, द रेडियोलॉजिस्ट एंड द कैंसर ऑन्कोलॉजिस्ट एंड द जीपी, एवरीवन विल बी वर्किंग विद यू आपको करने के
हम्म,
लिए।
हम्म,
हाउएवर हम चूंकि बात कर रहे हैं नॉट द एक्चुअल डायग्नोसिस एंड ट्रीटमेंट, our focus is mostly on the prevention and the early diagnosis. That means कि आप जितनी जल्दी स्क्रीन करवा रहे हैं। अच्छा, एक चीज और, sorry if I probably forgot to mention, sometimes women can feel a lump which would be painful or painless,
हम्म,
but हर lump होना breast cancer नहीं होता.
नहीं है
Sometimes
ये।
it's just a fatty tissue. Again, all the more reason to get yourself screened and ultrasound हो जाएगा, mammogram हो जाएगा, आपको clearly पता चल जाएगा. The
हम्म,
last thing that I'd like to mention कि mammogram is a very common test done around the world. Lekin obviously, like any other test, sometimes it can have false positive or false negative results in very, very few percentage of women. That is not a cause for alarm, because अगर किसी खातून का positive mammogram आता है, if there's something suspicious, the team
हम्म,
always asks the woman to come back, और उनका
हम्म,
फिर वो अल्ट्रासाउंड भी रिपीट करते हैं। और अगर जो स्पेशलिस्ट टीम है उनको लगेगा कि जी हमने एमआरआई भी करना है just to have further investigations, तो वो भी कर देंगे, and then she can have a clean bill of health, and everyone will realize, okay, it was just a, just a red flag, but it wasn't really, it was just something like a false positive result. So those sort of things can happen as well, but it's not the end of the world. एक टेस्ट पे आप इक्तफा नहीं कर सकते. So there are a battery of tests even after mammogram, which can be done.
हम्म। So I have this feeling that we have to meet again. We have to talk more about this because the clock is telling me
Absolutely.
to stop. लेकिन there is a lot to bring to notice as well. और भी ज़्यादा हमें मेरे ख्याल से बात करनी चाहिए और ताकि लोगों को
Absolutely.
और भी इंफॉर्मेशन मिले एंड दे लूज दिस फियर, जो ये डर है ना कि पता नहीं इससे क्या हो जाएगा, जबकि इसको करने से बहुत फायदा है और
बिल्कुल,
नुकसान
बिल्कुल,
ना के बराबर है जैसा आप बता रहे हैं. So
बिल्कुल.
Dr. Farwa, thank you so much for such an informative chat. And thank you for your time tonight. Really nice to talk to you. And friends, we don't need to be sick to appreciate health. Unfortunately, cancer is not something that you can wish away. The next best thing you can do is to get tested. So, because delaying diagnosis could mean more complicated treatment. So, catch it young, या क्या बोलते हैं कि भी हाँ at the
Nip
early
the
stage.
evil in the bud, I would say.
So stop waiting, book your appointment at the earliest. And thank you again, Dr. Farwa, for being
You're very
here.
welcome.
Thank you.
Thank you.